Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, February 19th, 2021. This is day 7 of our heightened alert status, and I'll turn things over immediately to Dr. Fitzgerald to give us an update on the latest numbers.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have 60 new cases, confirmed cases of COVID-19 in our province, all in the Eastern Health region and all under investigation. The age breakdown is as follows. 11 are under 20 years of age. 18 are between 20 and 39 years of age. 16 are between 40 and 49 years of age. 7 are between 50 and 59 years of age. 6 are between 60 and 69 years of age. And 2 are over 70. There are 9 new presumptive positive cases reported since last media, and 34 of today's 60 new confirmed cases are previous presumptive cases. There are now a total of 21 outstanding presumptive cases. As a reminder, a presumptive case means the individual tested positive using a rapid test. This is not a confirmed case until the provincial laboratory confirms it through a PCR test. The total number of cases in our province is now 863. And there have been 22 new recoveries in Eastern Health and 1 in Central Health, leaving 471 active cases in the province. 2 people are in hospital with COVID-19. 3,015 people have been tested since yesterday for a total of 103,654 people tested to date. This weekend marks 2 weeks into the outbreak. This means there will be hundreds and perhaps even thousands of individuals coming out of their 14-day self-isolation. Please remember that life outside self-isolation does not look a whole lot different than inside self-isolation. Regardless of whether you tested negative or have recovered from COVID, you must still adhere to public health restrictions and apply all your layers of protection. Keep your contacts low. Stay only to those inside your household bubble. Avoid indoor public spaces as much as possible. Only shop for essentials. Wear your non-medical mask when interacting with anyone outside your household bubble. While 2 or 3 layers are recommended, what is more important is that it fits well and has no gaps or openings for droplets to enter or escape. Maintain at least 6 feet from anyone outside your household bubble. A mask does not replace the need for distancing. They must be used together to be effective. Wash your hands or use hand sanitizer when you enter a public space, leave a public space, and when you return home. While we may be the face of the province's public health response, there are so many individuals supporting us that deserve our gratitude. The Public Health Laboratory is doing an incredible job in ramping up its capacity to meet demand. 2 weeks ago, the lab only needed to process just under 500 tests in a 24-hour period. Now they are doing more than 6 times that in the same amount of time. I cannot say enough about the phenomenal work being done across the healthcare system. Eastern Health's response to the outbreak has been exceptional. They have stood up an enormous logistical operation in a very short amount of time. Essential healthcare workers are out there on the front lines, from those doing the swabs outside in frigid temperatures and snowstorms to the contact tracers working around the clock. We also have essential workers who continue to care for and protect our most vulnerable residents, such as the staff in long-term care homes, personal care homes, as well as home care workers. I want to thank the many other essential workers outside the healthcare system who continue to go to work each day and to support the health and well-being of our communities. First responders, municipal workers, essential retail employees, and daycare providers. These individuals are all critical to keeping society functioning and maintaining the services we rely on. During Random Act of Kindness Week, I cannot think of a better way to show your appreciation than by doing something kind for an essential worker in your family or your neighborhood. And on a personal note, I'd like to send out a huge thank you to 2 of the kindest people I know. My parents' next-door neighbors, Donna and Daryl, they are looking after them like I wish I could if I wasn't 400 kilometers away. So thank you. Kindness and patience is just as essential right now as our layers of protection. I know there is so much information out there from so many sources, and not all of it is consistent and not all of it is accurate. For anyone who is already experiencing worry and anxiety, the search for answers may lead them down the wrong path. It is critical to pay attention to trusted and current sources. The Department of Health and Community Services website, the regional health authorities, the federal government, and the World Health Organization. The information from these sources stem from individuals who have dedicated their lives and careers to science behind infectious diseases and public health. Their goal is clear: to provide the best advice based on evidence in order to protect as many lives as possible. Saving lives is the entire reason we have these restrictions in place. As a recap for those who may have just joined us, we have 60 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 863. During this unprecedented time, we need more than ever to be able to lean on others for support and compassion, and to lift each other up when needed. Remember that there are bright spots in every day, even if some days we have to look a little harder to find them. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. We've now been one full week in lockdown under the heightened alert status. And I'd like to start, like Dr. Fitzgerald did, by recognizing some of the true heroes that have stepped forward and stepped up. To the frontline healthcare staff that have been braving the hard February elements to administer thousands of COVID-19 tests, confronting the variant head-on. We all can't thank you enough. Stopping the spread of the virus starts with you and the work that you do. And it is working. We've had a record number of tests administered, and wait times are much shorter than they were earlier this week. Though our numbers are up today, it means that we're identifying these cases from weeks ago and containing them. Our friends in the federal government have told us that our response to the variant outbreak has been one of the best they've seen so far, and will be and should be a model moving forward. That's a huge credit to Dr. Fitzgerald, her team, and frankly, each and every one of you for doing your part. As we have seen in places like New Zealand, the hardest measures will yield the best results. We can and will do this too. We will do it for the ones we love. We will do it for our families and communities from Makovic to Marystown and everywhere in between. I've seen so many stories this past week of communities going that extra mile when it's needed most, like the good people in Mount Pearl, arranging food for frontline workers, like the many businesses that have donated or responded immediately to the new safety measures. This is exactly the kindness needed right now. Local people and businesses, neighbors and friends, pulling us together in spirit when we are to stay physically so far apart. These gestures, big and small, will collectively sustain us all. And we all must ask, what more can we do? We do it because helping is in our nature. Survival is in our blood. And Newfoundland and Labrador, we will survive this too and get through it together. So with that, I'll turn it over to Dr. Haggie for some brief comments.
Thank you very much, Premier. Day 348, and the numbers are what they are. We have still a significant number of new cases by whatever route we are detecting them, and it's important that we continue to listen to Dr. Fitzgerald and public health and their measures. I'd like to expand a little bit on some of the comments earlier. I've been hearing a lot about truckers and from truckers. These individuals who work very hard are not our enemy. They indeed are our friends, and without them, we would not have food, fuel, medical supplies, or really a lot of essentials. And I think we need to bear that in mind as part of Dr. Fitzgerald's exhortation to kindness. Interestingly enough, some others have also seen the plight of truck drivers. There's a restaurant here in my own district on the TCH who has put up on social media a truck-friendly environment and contactless delivery for truckers to avail of a hot meal and a hot drink. and use their facilities safely should they need to. Minister Parsons and Lieutenant Collins of the Salvation Army in Port aux Basques have been working behind the scenes, and both informed me that the Salvation Army will be putting in their mobile kitchen, as they did during the last Alert Level 5 lockdown in Port aux Basques, and that this will be available to provide food and refreshment and hot drinks to truck drivers starting hopefully on Sunday. And to all of those individuals, individually and collectively, my thanks, certainly. It is Kindness Week, and I think, as has been said, these are important steps to recognize the difficulties that some of our essential workers do have. Again, in terms of thanks, Eastern Health have really done a superb job. There are 83 people currently awaiting testing in Eastern Health. There are single-digit numbers in each of the other regional health authorities. This did not happen by accident, and given the fact that there were 7,000 waiting in one regional health authority as of Saturday night, Sunday morning, that is all the more impressive. Dr. Randall and Dr. Zaharides in the public health lab and in our department have done amazing things with the laboratory and is now testing regularly more than 3,000 people in a day, and that actually is significantly smaller number some days than the number of tests they actually perform. So again, I would like to close by simply echoing spread kindness, not COVID. We can get through it, and if we follow the recommendations from public health and the guidelines, we will stay safe. Thank you very much, Premier.
Well, thank you, Minister. With that, I'll turn it over to the media for some questions.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
My questions are about the presumptive positive case from Makova. Can you give us an update? Has that gone through confirmatory testing yet, or is that one of the ones still waiting for the backlog? And can you provide any more details about this person, for example? Were they vaccinated, like many people in Makova have been?
So, I can't provide any personal health information about anybody, but certainly the presumptive case has not been confirmed at this time at the laboratory. My understanding is that confirmatory testing was negative.
So can you elaborate, what's the meaning then? If that test is negative, does that mean that this was a false positive, or what's the situation that we're dealing with here?
So we're still working through that, and certainly we'll have more information. We'll release it when we have more information.
Okay, thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Peter, I think you might be on mute there.
Sorry about that. I may be wasting a question here, but I wanted to reconfirm. Are you saying that the positive presumptive case in Makova has tested negative in the laboratory?
Yes, that's correct.
Okay. And another question I have, with regards to rapid tests, has the department given any consideration to using rapid tests other than in crisis situations, like we're in today? For example, could they be using them for sporting meets or to screen people traveling to regions of province?
So again, you have to be careful with these tests. So they're performing well right now because we're in a situation where we have an increasing prevalence, and we're using them on people who have a higher probability of having a positive test. When you use them in situations where there's a lower probability that people will test positive, so in situations of lower prevalence or with no exposure, then you have a higher risk of having false positive tests. So it's, we do have to consider how we use them, and we have to consider what we do with the answers that we give. For example, if we were to use the PanBio test in a pop-up clinic, as is happening in some areas, then we have to consider that, not every case may be detected in that situation. So it's great for us to try to get a snapshot of what's happening in an area, but it's not necessarily good for saying to someone, you have COVID or you don't have COVID definitively as a single test. So it very much depends on the situation that you're applying it to.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, we've announced 60 new cases today, and initially we announced that our circuit breaker measures would be for a 2-week period and that they would be reviewed after that 2-week period. Since we have not seen our numbers gradually going down over the last week, is it safe to say that we'll be extending those measures, and do we anticipate perhaps lifting them in other regions that have not seen a surge?
So at this point, we haven't hit that 2-week mark, so we haven't really decided on that. But certainly, if we still have increasing cases, the chances of us taking away the restrictions that we have in place right now would be very low. With regard to other areas of the province, we haven't considered that yet. We're still trying, as I said, we're using those pop-up clinics as a snapshot to see what's happening in other regions of the province, and we really want to get that information in first before we make any decisions about lifting restrictions elsewhere.
Thank you. And we've been hearing a lot of confusion surrounding isolation requirements in regards to this new strain. For example, we heard from one lady who says her son tested positive, he has no symptoms, and has been told by public health that he can come out of his room on Sunday. But now they're told that because he was exposed to the new variant, when he comes out, the whole family has to continue isolating for an additional 14 days. But she says that other families in similar situations haven't been told the same. So because there's so much confusion going around about isolation requirements, can you clarify what exactly the requirements are and what is different because of this new variant?
So certainly we're not, what I will say first of all is, if public health has advised you about isolation requirements, you need to follow what public health is saying. Some of these situations can be very nuanced, and people may not understand quite the difference between one case and another. While they may seem very similar on the surface, there may be other things that result in different advice being given. So we have to remember that. What we know about this virus is that, or this variant of the SARS-CoV-2 virus, is that it is much more easily transmitted within households. We have many examples in our outbreak right now where everybody in the household has become infected with this virus. So it is quite transmissible. We know from other areas that transmission has happened with very minimal contact between people for short periods of time. So for that reason, we're being extra cautious. So if families are not able to isolate apart from each other, if there's been sharing of space where this variant could be spread more easily, then after the case has been deemed recovered, then the family would still have to isolate for 14 days post that time. And the reason for that is that if they've been in the same space with each other, there is still a chance anywhere in that 10-day window where the person is considered infectious that they could infect another person right up until day 10. So we have to count our last contact with an infectious case at day 10 and then add 14 days of quarantine on top of that.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. When it comes to testing right now, with the amount of tests the lab are receiving, are we, and I'm sure this has been touched on this week, but I'm just looking for clarification, are we sending all to the national lab to be confirmed for variant or whether it's the COVID strain we're used to? And are we still testing them for influenza?
So right now, I think everything is being tested for COVID. We're not seeing much else circulating at the moment. So there are some specific circumstances where some of that testing may happen if it's requested or if it's a high-risk situation, if we're trying to find out what might be happening in a, say, a long-term care facility or something like that. We may do that full panel testing, we call it. But right now we know that what we have circulating is COVID, and that's what we want to find. So that's what we're testing for. And at this point, no, not every sample is going to the lab for whole genome sequencing. We would have to apply, some criteria to what is actually being sent off to be tested for whole genome sequencing. We assume that most of our cases that we have now, especially those that we are identifying through community spread with no known source immediately, would be related to B117. So.
Thank you. And when it comes to testing right now, a lot of people still waiting on results, but we're also hearing about lost tests. We've seen Eastern Health advisory for anyone after February 15th who hadn't received a call to reapply. But now hearing about people who have heard from public health that their test has been lost and to presume it's positive. Do we know how many tests approximately have been lost?
Tests have been
Maybe I could take a stab at that one, Premier. To speak about the turnaround at the moment from call to testing and results in Eastern Health is currently around 24 hours, the whole process. What we're seeing, I think, is some of the tail of the busyness of last weekend. The current turnaround time is around 11 hours for a result within Eastern Health. I think there were two separate groups there. One is there were a group of 1,500 people who either didn't give correct contact information or have received repeated calls from Eastern Health which they have not picked up and answered. And that's what the plea was, to resubmit their assessment forms, simply because we couldn't use whatever information we had to get hold of them. The second group of people with very long turnaround times, I think may need a case-by-case examination. Quite frankly, I would suggest that individuals who have waited 3 or more days for their result, and it's not available online, should go back to either 811 or the public health number they had before and make direct inquiries about their specific circumstances. I will go back to the laboratory and see what data we can find out about that. It's one of those knowing what you don't know kind of things. It's an unknown unknown. So we'll look into that, but I don't have that information at the moment, Kellyanne.
I appreciate that. Thank you.
Our next questions are from Alex Bill with All Newfoundland and Labrador. Please go ahead.
Good afternoon, Dr. Fitzgerald. I'd like to ask about the rise in your personal popularity and how you feel about it. You made a social media post asking people not to give you gifts. I imagine you're aware of the petition regarding the Munn Science Building, and at various times, some of my peers in the media have been quickly maligned online if they ask unpopular questions at briefings. How do you handle and respond to all of that?
I think, I thank people for being very kind and for reaching out, and there have been some beautiful things done. I'm awed by the talent that people have in some respects, and I'm grateful. As I've said before, I'm just one person in this whole cog wheel of public health, and so I certainly couldn't get up here every day and do what I do without all that support. I'm appreciative, and I don't really know what else to say about that.
Alex, I think we're all very grateful that Dr. Fitzgerald and her team are doing the best they can under trying circumstances, and she's very humble, but again, we're all very grateful, and she deserves all the accolades that she gets.
And is this celebrity status, for lack of a better phrase, something that you've discussed with your fellow chief medical officers in other provinces, or otherwise sought professional advice to try and just deal with and adjust to so you can focus on the pandemic?
No, I don't think we really do. It's, when we get together, we've got pretty pretty serious stuff to talk about, and it's usually a lot of stuff to talk about, so we usually just get right to business. So no, it's I think we're each trying to work through it in our own way.
Okay, thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Thank you. Dr. Haggie, I'd like to ask you about the rate of vaccinations. If I'm not mistaken, there were some vaccines expected this week. I'm wondering if the shipment arrived, or was it part of the shipment delayed by U.S. weather? And if it did arrive, did you receive the amount you were expecting?
Yes, that's a good question. It did arrive. It did arrive a day or so late because of some of the weather conditions. There were 5 trays. 3 have been allocated to Eastern Health and 1 each to Central and Western. Labrador is currently using the Moderna. In terms of their allocation, Eastern Health has finished long-term care in congregate living for the first dose and is moving out into rural long-term care. Central is hoping to complete first doses of all its long-term care and congregate living this week, and Western is on track to do the same for next week. We expect 5 more trays next week, and we will work through the NACI guidelines to identify essential workers next, particularly at risk from COVID, and then work out into other areas. My understanding is that the Apakek First Nation will receive their first doses for essential workers and over 60 this week, and then the rest of the community will be done with the next tranche of vaccine the week after. We currently are running around 84% distribution, or rather administration, of the Pfizer vaccine that we receive. The Moderna numbers are a little bit harder to quantify because they have to go and there's significant travel time and weather holds. But the coastal communities of northern Labrador, I think all but one may have had their second visit, which will give first doses to those who missed them and second doses to everybody else. We have had and will experience both a delay from Moderna and a slight reduction in amounts. Hopefully this will be corrected by the beginning of March.
Thank you. Premier Furey, was the disappointing rollout of vaccines in Canada discussed during the conference call yesterday evening with the Prime Minister and other provincial premiers? And how would you describe the mood of the people on that call? Frustrated?
Yeah, sorry, I was not on that call yesterday evening. I have spoken with my federal counterparts and other premiers individually, and we all recognize that this is a struggle, but we also recognize that there seems to be more security coming around supply chain with respect to vaccines. And of course, everyone would love to have everybody vaccinated today, right now, but that's not the reality. And there'll be plenty of time to rehash what went well and what didn't. But the focus should primarily be on securing and establishing a supply chain that enables us to continue with the vaccine.
Thank you.
Our next questions are from Justin Brake with The Independent. Please go ahead.
Good afternoon. My first question is to whomever I guess is the appropriate person to answer. Many in Labrador were wondering yesterday why there was no news conference in light of the presumptive case in Makovic, which there was some confusion around. So I'm wondering what's being done to ensure that equitable access to information on COVID-19 in Labrador, including addressing public concerns there in a timely manner. What's being done on that front?
Well, it was yesterday, there wasn't the scheduled media availability. We did reach out through the appropriate channels to the communities involved, including I spoke with President Lamp and leadership within the Natsivik communities many times over the last several days, as did Dr. Fitzgerald, not Dr. Fitzgerald's team and surrogates for Lab Grenfell. And we disseminated the information as best we could given the evolving situation, and we're trying ourselves to get the best accurate information surrounding that case so that the most appropriate and accurate information was distributed to those communities. But I have had open lines of communication, two calls a day with President Lamp, and his ministers and government to ensure that we are communicating as best we can, given an evolving situation.
So what specific arrangements does the province have with the Innu Nation, Nunavut government, and Nunatuavut Community Council in light of the possibility that the virus could be in Labrador right now?
Well, we just had myself and Dr. Fitzgerald just concluded a call with the Indigenous leadership throughout the province, including the Indigenous leaders in Labrador, and we discussed numerous things, including vaccine and border control. And we are committed to continuing to work collaboratively with them all to ensure that we're developing the right strategies to protect them and their communities. And we're committed to regular updates, of course, with them, and frankly, the other Indigenous leaders on the island portion of the province as well.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, yes, hello. I would like to speak about our education system right now. There are critical periods of cognitive development in children, and a lot of parents may be feeling that the last 12 to, say, 14 months have heavily interrupted what could prove to be a very important time in their child's development and their education. And of course, I'm speaking of like key fundamentals like reading, writing, a basic understanding of math or logic and problem solving. I'm just wondering if you're aware of any research that suggests that we really don't have to be as worried or concerned about the development of our children and possibly having missed critical educational periods.
Well, I think, that social research is ongoing right now. I'm not aware of any recent studies personally. I mean, I can comment on my own situation, but we can't forget that because of Dr. Fitzgerald and her team and the advice and the measures that we had taken and after the previous lockdown, that our children did have a period of school where many across the country did not. So we're into this situation now. But they were afforded, because of working with educators, the NLTA, Dr. Fitzgerald and her team, we were able to open the schools in September, where many across Canada and in the United States are still struggling to figure out how to reopen schools. So they did have some, in-person education. I have to say, from my own personal experience, again, this morning, hearing my son speak with his class, as I eavesdropped when I was getting a cup of tea, the quality of education being provided, granted it's anecdotal and to myself, and I'm not saying that there won't be other stories, but I was quite impressed with the quality of education that was being delivered, and I think is reflective of the educators, teachers, administrators, the NLTA, everyone who's worked hard to pivot to this style of education. But of course, your question is one that we don't know the answer to, frankly, and I'm not sure that anyone does right now.
I understand, and I can appreciate you being forthright in saying that you don't know the answer to it, and I certainly wouldn't want anybody sitting at that table or on a call from Gander to think that as a public we are ungrateful for the fact that our children have been in school when in a lot of other places across Canada they haven't. Just trying to find a way to help parents be at ease when they're having a hard time working from home and their kid won't get off them and school is only an hour and a half or whatever, and they might be worried about the years to come for their children. And
and Jason, that's a great question, and I can totally appreciate and empathize with families going through that right now. I mean, I'm going through it, and I understand, and we all want what's best for our children. I think we'll all agree with that. I wish I had definitive answers about what impact this particular system would have on childhood development, but frankly, that's a little bit outside my area of expertise. And the system is there to support. If people are struggling with the education system, I encourage them to reach out to the department, and we'll see if we can kind of work through the solutions as best we can, given the scenario that we're in. But I completely empathize with parents, educators alike for the struggles of this new system. But again, it allows us to pivot, as others have, to protect our educational opportunities given the circumstances that we're in.
I appreciate that. Thank you very much, Premier.
Our next questions are from Peter Cowan with CBC. Please go ahead.
There's been widespread testing of inmates and staff at the penitentiary. I'm just wondering, have there been any positive results in that environment, and when are inmates slated to get vaccination?
So I'm not aware of any positive results, and other congregate, of course, in our phase 1, we looked at congregate living facilities for seniors, and in phase 2, other congregate living facilities are being considered as priority in that. So it will happen during phase 2.
And a question probably best for the minister. It's about MCP coverage. International students, when they graduate, in order to maintain their coverage, they have to have a full-time job. We spoke with one woman who wants to stay here but is struggling to find a full-time job during the pandemic. And she'd like to know why the province isn't extending MCP coverage, especially in the middle of a pandemic, to cover these people until conditions improve.
Thanks, Peter. That's a very good question. Certainly, in the past, we had been very flexible during COVID wave 1 around that issue. I think some of the standard policy stuff that would have come across my desk as minister does not do that now because of the caretaker convention. What we have said also is that no person residing in this province in that situation would be denied coverage for healthcare issues simply because of administrative issues during the time of COVID. So, unfortunately, until the caretaker period is over, it would be difficult for me to act, but I can certainly go back and look at the specifics of any individual were that person to contact the department.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, Dr. Fitzgerald, you've argued in the past that the low epidemiology in the province gave us the luxury of holding back second doses of vaccines rather than spreading them out as they have in other jurisdictions. Would you reconsider that idea of giving more people first doses now that we're in the current situation?
So certainly we want to try to vaccinate as many people as we can right now, especially in the metro area, given our epidemiology that's here. So those are all things that we have reconsidered at this point. We certainly wouldn't want to go beyond what the National Advisory Committee on Immunizations are recommending at this time, which is the 42 days. Our aim, of course, is to get as many people vaccinated as we can with 2 doses as close to the schedule as possible. But given that we have that little bit of leeway there to be able to get first doses into people in, for example, seniors in congregate living facilities throughout the province is very important at this time.
Okay. And I've heard people in quarantine not getting checked on at all, and others, such as rotational workers, being checked on frequently. Is there any kind of a standard protocol for monitoring compliance to quarantine?
Yeah, there is a standard protocol for people monitoring, the people we have monitoring travelers who are coming in. And of course, if someone is in quarantine because they're a contact of a case, that's a different situation, and public health is following up there, as opposed to people who are traveling where we have a different group of people following up. But yes, there is a protocol for what needs to be done.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Premier, I want to ask about COVID testing at the Muskrat Falls site. We hear that they're testing workers 3 times during their 2-week rotation. And given the amount of workers at the site, that would be, I would imagine, a significant cost to conducting so many tests. What can you tell us about the cost of testing at Muskrat Falls?
I don't have that information readily available. I'm not sure that you do, Minister, do you?
The testing at Muskrat Falls would fall to NALCO and is not MCP. So this would presumably be being done through private arrangements. So I wouldn't be able to have access to that directly. Maybe the minister responsible for NALCO would be able to provide some light on that. But again, that's an arrangement with a subcontractor. So I don't know that I want to step into that minefield. It's not MCP. It's not government money.
Okay. And Dr. Haggie, given that we have 2 people in hospital, what sort of capacity do we have right now in terms of ventilators in the province?
Well, if you recall, we had an excess of ventilators during wave 1, which I think was somewhere of the order of around 60 over the number of beds that we would have in intensive care. You will recall that we placed extra orders for those. We actually ordered a total of 84. 20 of those arrived a week or 2 ago, and the remaining group of 54, I have been told, as of this morning, a significant number of those have arrived at the Eastern Health Depot in Mount Pearl. There are some not there yet, so I don't know exactly what that number is. But in addition to that, we have additional surge capacity in the province available for our use of 50 more ventilators from the National Emergency Strategic Stockpile. Quite frankly, we're likely to run out of staff to run them before we'll run out of ventilators.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We know right now you're just to be with your household bubble. There's no double bubbling happening at this moment. But when it comes to custody, that's not to be impacted by the current alert level 5 lockdown. There's a lot of questions remaining around families who might be self-isolating, who share custody. Dr. Fitzgerald, do you have any advice there?
So if someone is self-isolating, that's a slightly different situation than someone who's just, living in alert level 5, right? Isolation has to happen in one place, and that's where it has to be. That's a different situation, but a short-lived situation, obviously. From a medical point of view, I think, it wouldn't be wise for somebody who could potentially be infectious to leave and go to another place. But when we're talking about alert level 5 and whether or not people, children with parents who have shared custody, of children, obviously the children would have 2 household bubbles. I mean, that's just the way it's going to have to be.
Thank you. And I'm getting a lot of concern from seniors, particularly when it comes to home care workers. What is the protocol right now with home care workers working between multiple homes?
So I believe the public health, there are protocols that are in place for how they do that safely, and they, mask wearing and things like that. And certainly, and people are screened. They're supposed to be screening before they go to work, before they enter anyone's home. So if they have symptoms or any exposures, they're not supposed to be going to work just as anyone would be in any of these, in any work-related situation. So all of those guidelines and protocols still apply.
Sorry, so they can work between multiple homes, though?
At this point, yes. I mean, it would be very difficult to provide home care to all the people that need home care if workers were completely restricted.
No, absolutely. Thank you.
Our next questions are from Alex Bill with All Newfoundland and Labrador. Please go ahead.
I think you're on mute there, Alex.
Alex, are you still on the line?
Oh, I apologize. I was on mute. Hi, Dr. Fitzgerald. One more question about your personal experience here. Are there moments that you wish you had your privacy back during all of this, and how do you kind of adjust to that?
Yes. And I guess I just got to build a bridge and get over it, don't I? So it is what it is, and we'll just deal with it.
I can only imagine. Have you had a chance yet to think about what that looks like and what your life looks like if and when we turn the page on COVID-19?
When, Alex? When?
Yeah.
Don't say if. Oh my God. I'm just going to leave right now. No, I mean, I'm sure after a short while, my face will fade back into oblivion. Just, that fleeting, well, probably more than 15 minutes of fame. But anyway, it'll.
But your name on the science building won't.
Yeah. So.
Okay, thanks very much.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Premier Furey, your counterpart in Manitoba, Premier Brian Pallister, has announced that the province is contracted to buy a vaccine that's being produced by a Calgary-based biotech company, which hopefully will be available by the end of the year. Premier Pallister calls it an insurance policy in the event that international supply chains that Canada's now dependent upon are still unreliable at the end of the year. My question is this. If the federal government fails to deliver on its promise of having vaccines available for every Canadian by September, do you think the Manitoba approach to securing a supply of Made Canada vaccine for citizens, they call their insurance policy, is an option for Newfoundland and Labrador?
Well, first of all, I think that this is an incredibly evolving situation with respect to vaccines. And as we see different approvals occurring at different times in different countries, and as the supply chain does go to scale, hopefully these numbers will change. Look, I think anytime there's options available to protect the public, it's certainly warranted to investigate.
You said you weren't on the call with the Prime Minister and your fellow premiers yesterday, but you have had conversations with some premiers. Have you discussed this with Premier Pallister? I know he said he's discussed it with some of the other premiers.
No, I haven't discussed it in particular with Premier Pallister. I did have a very high-level conversation with Premier Ford surrounding vaccines, and his province is looking, as I understand it, at options to prevent this from happening in the future by attracting manufacturers to Ontario in general.
And a second question.
Well, that was actually two questions, Roger. Roger, that was your two questions. Sorry.
Oh, my apologies.
Our next questions are from Justin Brake with The Independent. Please go ahead.
This question is for Premier Furey. Just to sort of demonstrate to Inuit and Mi'kmaq in the province who may be wondering whether leadership fully understands their situation with COVID, can you speak to the social determinants of health or the root causes that make Indigenous people particularly vulnerable to infectious disease?
Well, I think all three of us could probably speak to that, but when we know from the research to date that Indigenous communities have a higher risk of morbidity and mortality, frankly, associated with COVID-19, and we need to make sure that, therefore, we're protecting their communities, and that's why we have been doing exactly that and putting vaccine in those communities first as a priority. I know, it's troubling and frightful news, and I appreciate the anxieties in Makkovik. I felt my heart stopped when I heard that on, what day is it today? On Wednesday night. But up to 80%, I think, have had their first dose of vaccine in that community. That's frankly excellent. And some of the conversations that I've been having with the Indigenous leadership has been to encourage them to continue to encourage the uptake of vaccine in their communities. Because again, we know that this virus has a greater impact on their communities than non-Indigenous communities.
And in light of these, pre-existing circumstances that kind of, I guess, increase the precarity for Indigenous communities, in addition to expediting vaccines to the communities, what else is being done, or what have you learned from this situation that might improve health outcomes in the event of another wave or something in years down the road?
Well, I mean, this situation is still evolving. I think we'll all learn lessons that we can apply to different scenarios in the future after we get through this. But I think, it's a lesson for any crisis situation, if you will, that having open lines of collaborative communications between different levels of government is incredibly important. in helping not only with the communication as an essence, but also in helping navigate the situation as it evolves, and to hear the stories from Makovic about lines, skidoos lined up and the clinics happening, and people being very kind to each other and supportive as they're getting their tests was very heartwarming to me, and I'm sure to President Lamp. And again, I think if you're going to ask me for an immediate lesson right away, it would be definitely having these lines of communication well open far in advance. And I would think that all the Indigenous leaders across the province would suggest that we've always had a good working relationship. And in times of crisis, you can lean on that open phone line, if you will, to ensure that we're navigating it as best we can.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Yes, hello, thank you. There are concerns and, frankly, anonymous reports of people who skipped self-isolating while waiting for results, either because of vanity or ignorance or just selfishness, and then have been found out to be positive. This is obviously an issue. My question is not so much about that issue as such, because I know that your contract tracing will find those people and we'll be able to cut that off. I suppose my question is a form of deterrent, what, if any, repercussions, other than the obvious social leprosy, does somebody face when they choose to make that kind of decision and not isolate while awaiting results?
Well, first of all, I think I'm safe to speak for all of us when saying, please don't do that. I mean, that's you're for vanity or ignorance or whatever the reason, you're putting everybody else at risk. We've seen how fast this variant can spread, and it's a forest fire once it starts. So please check your ego and check your ignorance, and don't do that. As per repercussions, there are, there's lines of communication, and Dr. Haggie, you can probably speak best to this in terms of reporting breaches in protocols, but they're certainly open for people to help, or report if there is a breach. But frankly, please don't. And if you're unsure of the protocols, there's lots of information around. The website is fully, you educate yourself before making an ignorant or vain decision. But Minister Haggie, do you have any further details on that perhaps you could provide with respect to reporting?
Yes, thank you very much, Premier. We do have a complaints form, and this is triaged, I think, still by the RNC, and then distributed to whichever law enforcement agency has jurisdiction in that particular area. There has been a significant uptick in complaints over the last 3 weeks, according to data I saw recently. I couldn't give you the numbers, but I can certainly provide a snapshot for January and February for you offline. What I do know is that the law enforcement have their own kind of protocols. They adopt the encourage, educate, and then enforce step approach. I am aware of no summary offence tickets that have been issued, but I'm also aware that there are charges against 2 individuals pending before the courts about allegations of having breached a requirement under a special measures order.
Okay, so it's good to hear that there are repercussions. And you spoke about how this particular variant was so much more easily transmitted, and that sort of makes me think about the conversation about asymptomatic positive cases and being told that you can be confirmed as no longer positive. You are confirmed negative 10 days from being confirmed as positive when you are asymptomatic. And I'm sure, because I know all the decisions that you are making come from science, they come from the data, and they come from a whole lot of education, which is why you're the ones making the decisions. I'm wondering if you could offer some insight into those of us that feel uncomfortable in hearing that, so that we can ease our worry around it.
So the question is asymptomatic.
How do we know that 10 days without symptoms is long enough for somebody to actually no longer have COVID-19 when we don't know how long they've been walking around with it to begin with?
So what we know is that for people with COVID-19, that after somewhere between 8 and 10 days, the amount of virus after the onset of symptoms, that the amount of virus in their system is not generally high enough to infect anyone else, and it's not generally viable, so they couldn't grow it in culture, for example. With regard to people who are not symptomatic, certainly we know that viral load tends to decrease, and again, after 8 to 10 days, generally is not at high enough levels to be considered viable in the laboratory. So there have been studies done in these regards, and certainly the epidemiology has borne that out, in that we don't see that there's a lot of people who end up infecting people after their 10 days. We don't see a lot of reports of that. The information that we have so far about this new variant does not change that information at this point. Obviously, it's new, we're learning lots, and if at some point, the information tells us something different, the evidence tells us something different, then we'll have to change. But as of right now, so far, we're not seeing anything that's changing that advice.
That makes a great deal of sense. Thank you for explaining the science. I'm sure it'll level a lot of heads. Thank you very much.
You're welcome.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yeah, I just want to go back to the Makovic situation. Dr. Fitzgerald, I think people are a little bit confused. You said that the person tested negative on the PCR test. Can you explain just exactly, does that mean that they don't have the virus, and what are the next steps going to be as you continue the investigation?
Yeah, so if somebody else, I can speak more in generalities, I guess, as opposed to about a specific situation, because I'm not on the ground there, and I don't have all the information. I don't want to misspeak. But if somebody tests positive on one of these rapid tests, so these point-of-care tests that you can do very quickly, then we have confirmatory testing, and that confirmatory test then is negative if it's done at the same time. If the sample was collected at the same time, then you have to think about that test in terms of being a false positive, presumptive false positive. So that's likely what would be the case here. I'm just waiting to sort of confirm that, really. I just don't want to speak out of turn.
Fair enough. Thank you.
Peter Jackson with The Telegram, do you have a final question?
Just a quick one. What can you say for two businesses such as tattoo studios, gyms, that sort of thing? Are basically in limbo now. They don't know whether they should be laying off employees. Is there anything you can offer them in terms of when they can expect some developments in the health orders or in some kind of assistance or anything to that effect?
With respect to the health orders, I think that Dr. Fitzgerald's kind of already answered that. It's too early to tell, safe to say, with respect to restrictions of businesses in Alert Level 5. The business response team number is still up and running for people in that scenario. If they want specific guidance surrounding their business, we're still looking at all options available to us, including some of the options that were available before. Just happen to have that number here just in case. It's 1-833-771-0696. So if small businesses or businesses and communities, community businesses are interested in wondering what's available, they can certainly reach out to the response team.
Thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, I was contacted by somebody who said that their son went and had a COVID test done, and after a little while, they went back. They called back public health to see what the result was because they hadn't heard back, and they were told that the result was inconclusive and that their son needed to get tested again. This person was worried that had they not been contacted, had they not reached out, they wouldn't have been contacted. What is the protocol for contacting people about an inconclusive test result, and are you concerned that possible positive cases are slipping through the cracks?
I know, so inconclusive tests would get called to get recollected. That's been the protocol all along, and it will continue to be. You know, it's just a matter of someone making that phone call. I can't speak to the specifics of that situation, but you know, inconclusive tests will get notified to get recollected.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
I do. I'm just looking to follow up on one of my previous questions when it comes to self-isolation and custody. I know this is to do a lot with the courts too, but when it comes to self-isolation and the advice of it's probably best for someone not to be going back and forth from that place, what about rotational workers right now who are having to self-isolate when they return home? Is it the same advice there?
Sorry, Kellyanne, you kind of blurred it's difficult to hear.
Sorry, when it comes to shared custody, I know a lot of this lands with the court system, but from public health perspective, Dr. Fitzgerald, you noted it's probably best for someone not to be going back and forth from somewhere that someone is self-isolating from, that they need to isolate away from people. Does this apply for rotational workers as well, as they're having to self-isolate right now, but many of them have shared custody?
So, I mean, at the moment, given that we're in alert level 5, we are recommending that rotational workers try to isolate away from their family as much as possible. I'd have to take that one back, Kellyanne, and have a look at that specifically off the top of my head. I wouldn't want to speak and say something wrong, so it's a bit nuanced. So I would rather make sure I have the right answer for that.
No worries. Thank you.
Alex Bill with All Newfoundland and Labrador. Do you have a final question? Are you still on the line, Alex? All right, we'll move on. Roger Bill with the Shoreline News. Do you have a final question?
Yes, I do. Dr. Haggie, when you were updating the statistics on vaccinations earlier, I was writing here trying to keep up with you, and I can't. Are the updated stats available at your department's internet site, or is it possible that somebody can pull together the up-to-date numbers, how many people have been vaccinated, how many more are being vaccinated, what your forecast is, and perhaps issue that as a release?
Yeah, good question. The website is updated usually on a Wednesday. We have had some technical issues with the site lately, but I can go and check on that. And if the information isn't there, then I will do my best to find it for you.
Thank you very much.
Justin Brake with The Independent. Do you have a final question?
Yes, I do. And this one again is for Premier Furey. The Truth and Reconciliation Commission and the National Inquiry into Missing and Murdered Indigenous Women both outlined actionable items, some of which would help close some of the gaps in health and access to health care for Indigenous people, which is particularly relevant right now. Can you outline the progress made on these files by your government since you became Premier?
We're always looking to improve health outcomes, especially in the Indigenous communities. We again have started the Health Accord to look specifically at the whole province, but it's incumbent in that report will be with respect to Indigenous communities. I've had regular conversations with all the Indigenous communities and the leaders to talk about multiple issues in specific to them in their own communities, but also in generalities about health and how to improve it, how to improve education, how to improve all systems, so that we can work towards true reconciliation and some of the suggestions reported in those reports as you highlighted.
Thank you.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, I do. Thank you. Just to sort of walk through the process of somebody who goes to get swabbed. You drive through and you watch the nurses come back and forth, and they go out and swab someone, and they go in, and then they come out again. When you are tested, and then they reach down and they give you that little piece of paper, which to some people might look like one giant coronavirus. I'm wondering if you could offer some insight into what the nurse does behind the scenes that you don't see to make sure that there isn't contamination from one test to the next.
I certainly, I'm not on the ground, and I don't know exactly what's happening in the sites, after the sample's been taken, but there are protocols that are in place, and those are, standard protocols that are in place across the country for collection of these types of swabs. And so they go into the facility there, they get, they're labeled, they're sorted, and they're probably labeled before the sample's even taken, and then they're shipped to the lab. So, the samples there is a particular way that the samples have to be managed and have to be handled so that there isn't cross-contamination and those sorts of things. So, all those protocols are in place, but I'm not sure I'm the right person to answer exactly how that happens.
But Jason, I think we all realize we have some of the best healthcare professionals anywhere in the world working here in Newfoundland and Labrador, and we have to trust that they are following the protocols and doing their jobs, which I'm sure they are, having worked with them in my previous life. They're simply the best, and they'll be following the protocols strictly.
I appreciate that. Thank you very much.
Thank you, everyone. Premier, do you have any final comments today?
Sure. First, I'd like to thank all the Indigenous leaders for joining us on our call today and helping us work through some issues earlier today. And in particular, wanted to send a thank you to President Lamp for helping us navigate, and his ministers and community leaders in Makovic for helping us navigate that situation midweek. It's truly a collaborative approach, and I look forward to continuing to work as we get to the bottom of the situation there together. So it's otherwise 1 week down and more to go as we inch our way out of this heightened alert level, and it can't be said enough, and it was troubling to me to hear today some examples of people not following the guidelines. We absolutely have to follow the guidelines. It's the only thing that will work. That's the only thing that will get us out of this crisis. It's the only thing that will allow Dr. Fitzgerald and her team to move alert levels. So please follow the rules, look after each other, look after yourself. In Newfoundland and Labrador, we will get through this.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.